Welcome to the deep dive. We're here to cut through the noise, bring you the core insights, the surprising facts, and really practical wisdom from sources you need to know.
It's the goal.
And today we're diving into something truly incredible, a journey that's, well, universal but also intensely personal for millions. The 14th week of pregnancy.
A really key moment.
Exactly. It's not just ticking off another week on the calendar. It's often pivotal, exciting, and for many, quite transformative as parents-to-be move past those often tough early days.
Into a new phase, really.
Right, a more vibrant phase. Our deep dive today uses a really comprehensive, medically reviewed article from BabyCenter. It's called 14 Weeks Pregnant, Symptoms, Belly, Bump, and More.
Good source. Very detailed.
Yes, and our mission, like always, is to dissect it. Pull out those nuggets of knowledge that really matter, giving you, our listener, a kind of shortcut to being well-informed. Practical advice, those aha moments that really shine a light on the big shifts happening for both the parent and the baby as they step into the second trimester.
And what's truly fascinating about week 14 is exactly that transition you mentioned. It's not just some arbitrary point. It officially marks the arrival of the second trimester.
Which is a big deal for many.
A huge deal. For many expecting parents, this isn't just a new phase. It's often their favorite part of the pregnancy, a real turning point,
Why is that generally?
Well, the promise it holds is pretty substantial. Usually a big reduction in those early pregnancy discomforts, like the really tough nausea and fatigue.
The morning sickness hopefully fades.
Exactly. Energy levels often start to come back quite dramatically. And beyond that physical relief, there's this profound anticipation. Maybe feeling the baby move for the first time, those little flutters.
Even if it's subtle at first.
Very subtle. And of course, the excitement of potentially seeing clearer, more detailed confirmation on an ultrasound. It brings that internal process to life. Gets it very real. So yeah, we're going to really get into the depth of this week today. Everything from those tiny, intricate fetal developments you can't even see to the really practical checklist items for the parent. It's a full look at a very dynamic, hopeful week.
That sense of hope and renewed energy, I think that's something so many people really look forward to. And that sets us up nicely for our first big topic. Welcome to the second trimester. A new chapter unfolds.
The threshold moment.
Exactly. The source material really highlights this week as a major milestone. You officially cross into the second trimester. Time to exhale, maybe.
For many, yes. A chance to breathe a bit easier.
It emphasizes why this is often many moms' favorite part of pregnancy. Think about that feeling of relief as those early, sometimes overwhelming symptoms like severe morning sickness start to fade.
That constant queasiness just lifting.
Right. Replaced by, hopefully, a noticeable return of energy. It's like getting your stride back, feeling a bit more normal, maybe even a bit more like yourself after weeks of feeling, well, pretty rough.
Definitely. Reclaiming some sense of self.
And then there's the sheer excitement bubbling up around the developmental milestones happening. Even if you haven't felt movement yet, your baby is making those first tiny flutters inside.
A little internal dance starting.
Yeah. Plus, ultrasounds around this time. They can offer an incredibly clear, detailed views of your little one. It transforms this abstract idea of growth into something tangible, almost awe-inspiring.
A really powerful moment of connection for parents.
Definitely.
And if we connect this to the bigger picture, this transition isn't just physical, right? It's deeply tied into the whole emotional and psychological journey.
How so?
Well, as your body starts to visibly change, maybe that first hint of a bump appearing, many parents feel this innate urge to capture this really unique fleeting phase.
Ah, the photos.
Exactly. That's where the practical tips in the source about when, where, and how to get the best pregnancy pictures become so helpful. It's not just about vanity,
No, it's about memory.
Precisely. It's commemorating a unique time, creating a visual diary of this incredible transformation. These pictures become really cherished memories later on.
Makes sense.
And kind of hand in hand with those visible changes. And something that always brings up questions is the discussion around weight gain.
Right. Always a sensitive topic.
It can be. But the gaining weight section in our source is really insightful because it goes beyond just general advice. It stresses tracking your weight gain against a medically reviewed chart.
Okay.
This helps you understand your target range based on your individual starting point.
So it's personalized, not just one number fits all. That must be crucial because every pregnancy is different.
Exactly right. The source explicitly points out that this target weight gain varies quite a bit. It depends on your pre-pregnancy weight, often based on BMI, and really importantly, whether you're carrying one baby or maybe twins or more.
Okay, so context matters hugely.
Hugely. It's far from a simple directive. And what's vital for expecting parents to grasp are the reasons for this necessary weight gain. It's not just casually eating for two.
It's functional.
Absolutely.
Yeah.
It's crucial for the baby's healthy growth, yes, but it's also fueling your own body's incredible adaptations. Like your blood volume increases massively, sometimes 30–50%.
Wow, that much?
Yeah, to get nutrients and oxygen flowing optimally. Your breasts are growing, preparing for feeding. Your uterus is expanding dramatically. That adds pounds all by itself.
Right, the structure's changing.
And beyond that, your body is strategically building fat stores. These are vital energy reserves for later pregnancy demands and for breastfeeding after birth.
So it raises that question.
It does. How do your body's specific needs translate into healthy weight gain for your pregnancy? What practical steps can you take to meet those needs without over or under gaining?
Yep.
It's definitely a nuanced conversation to have with your doctor or midwife.
That's such a helpful way to frame it, giving that full context for weight gain. It's not just about the number on the scale.
Not at all.
Okay, speaking of incredible internal happenings, let's shift gears into section 2. Incredible tiny transformations baby development at 14 weeks. This is where it gets really fascinating, zooming right in.
The microscopic marvels.
Totally. Our source mentions the baby is making faces. Can you even imagine? It's not emotional expressions yet, obviously, but thanks to early brain impulses, those tiny facial muscles are getting a workout.
Little practice sessions.
Yeah, we're talking squinting, frowning, even grimacing. It's amazing to think about these earliest expressions forming.
Truly remarkable.
And it's not just faces. The baby is also making early sucking and chewing movements. What does that signal about their readiness for life outside?
It's absolutely signaling that. These aren't just random twitches. They're fascinating biological precursors to independent life. The sucking and chewing, those are vital reflexes for feeding after birth. Foundational stuff.
Like prepping for their first meal.
Pretty much. And beyond the face, the source says soft baby hair is starting its journey. Hair follicles have begun forming deep in the skin.
So actual hair.
Well, the follicles are there. What's interesting is that around week 20, this fine, downy hair called lanugo will sprout from them. It first shows up on the eyebrows, upper lip, chin.
Lanugo. I've heard of that.
Yeah, it's temporary, helps regulate temperature, anchors the protective vernix coating. And even though they're tiny, the source stresses your baby is incredibly active at 14 weeks.
Kicking and punching already.
Tiny punches and kicks, yes. Even if you, the parent, can't usually feel them yet, that often comes a bit later. They are definitely happening.
Yeah.
Flexible hands and feet, constantly moving, stretching in the amniotic fluid.
All that movement is important, right?
Absolutely vital for muscle and joint development. They're not just floating passively.
That's just mind-blowing, all that detailed activity happening inside. Now, speaking of size, the source has this bit titled, "They grow so fast," which might confuse someone tracking week by week. It looks like a huge jump in length suddenly.
Right, and this raises an important question about how we measure this rapid growth accurately. It clears up a common confusion point. The source explains that the reason this week's fetal length measurement is so much bigger than last week's isn't that the baby magically doubled in size in 7 days.
Phew, okay.
Instead, there's a key change in how they're measured, starting around 14 weeks. Before this, it was usually head to bottom, crown to rump length, because the baby's often curled up, you know.
Like a little bean.
Exactly. But now the measurement shifts to head to toe. Think of trying to measure a curled-up kitten versus one stretching out. That's kind of what's happening. The baby's starting to extend their posture more.
Ah, so the method changed, allowing for a longer measurement.
Precisely. It reflects a more extended posture, giving a more accurate full-length picture. And to give you a tangible idea, at 14 weeks, your baby is about the size of a lemon.
A lemon, okay.
Specifically around 5.79 inches head to toe and weighing about 3.28 ounces. Still tiny, but a significant milestone in length as they stretch out.
A lemon doing gymnastics in there. Wow. And beyond the external stuff and muscles, what about internal organs? Anything major happening this week?
Absolutely. The internal systems are continuing their remarkable development. The source notes the baby's liver is already producing bile.
Bile. For digestion.
Yes, a key digestive fluid. But what's really insightful biologically is that it won't actually be needed for digestion until after birth, when the baby starts feeding independently.
So it's prepping way in advance.
Exactly. It beautifully illustrates the foresight of fetal development. Systems mature, anticipating future functions, sometimes long before they're used externally. It's pre-programmed biological precision.
Amazing.
And just to circle back on the hair we mentioned that fine minute ago, it'll keep growing over the next month or so. Forms a temporary fuzzy coat, helps insulate, helps the vernix stick, usually disappears before birth or soon after.
Got it. These scientific details really paint a picture. Now, the source also includes some lighter, more fun elements, ways to connect personally with the journey.
Yeah, those can be nice little touches.
Like the BabyCenter Zodiac feature, it's just a fun way to maybe playfully explore what your baby's sign might suggest about their future personality. Taps into that natural curiosity, who is this little person going to be?
Adds a bit of playful speculation.
And then there's the Uncover Your Nesting Personality quiz. This connects to that powerful urge many parents feel to prepare.
Oh, the nesting instinct. It's real.
Definitely. Whether you're suddenly obsessed with nursery colors, organizing tiny socks, or maybe just mentally preparing, this quiz kind of helps you decode and maybe even celebrate your specific nesting style.
Embracing that drive to get ready.
Yeah. And there are others too, like a pregnancy energy level quiz acknowledging that some days you're powering through, others not so much. No judgment. Just vibes, as they say.
Totally normal to fluctuate.
And a pregnancy-style quiz, too. It emphasizes that every journey is different, and so is your vibe during it. These quizzes are just lighthearted ways to reflect on your unique experience.
Adds a nice personal dimension to all the biological stuff.
Okay, let's unpack this next big topic. One I know many expecting parents are really keen on, the easing of morning sickness. This brings us to section 3. Navigating your body's changes, symptoms, and sensations.
A welcome section for many.
Definitely. The really good news, according to the source, is that for many, morning sickness is likely easing up, or maybe even gone by week 14.
Finally.
Right? Your energy is probably returning. That constant queasy feeling might be history. Maybe you even enjoy food again. It's a huge, often transformative relief. Lets you actually embrace the pregnancy more.
Absolutely. Makes a world of difference.
But the source is careful, and this is important to note that although it's uncommon, some expecting moms will still feel nauseated months from now.
It doesn't always vanish right on schedule.
Exactly. So if you're in that group and the nausea or vomiting is still severe, especially if you're having trouble keeping anything down, it's really important to talk to your doctor or midwife soon.
Don't just suffer through it.
No. Conditions like hyperemesis gravidarum are rare, but they need medical attention. Always prioritize your health.
Good advice. And what's fascinating here is how the body adapts so dramatically, both inside and out, with these hormonal shifts. Along with morning sickness maybe easing, you might also notice a big visual change. You're starting to show.
The bump.
The bump. The mechanics are pretty straightforward. The top of your uterus has now risen up a bit above your pubic bone.
Okay.
For many, especially first-timers, or those with strong core muscles, this is enough to start pushing your tummy out just a tad. That first visible hint of a bump.
That must feel significant.
The source says, starting to show can be quite a thrill, giving you and your partner visible evidence of the baby. It makes it tangible, validates the journey after weeks of it being mostly internal.
And people's bumps look so different, right?
Absolutely. The source even mentions a pregnant belly's photo gallery, which is great for seeing the huge range of normal. There's no single right way to look at 14 weeks.
That's incredibly reassuring, managing expectations. What other physical things might pop up, maybe less talked about?
Well, another common one, sometimes surprising, is bleeding gums. Pregnancy gingivitis.
Oh, right. Why does that happen?
The source says about half of pregnant women have swollen, red, tender gums that bleed when brushing or flossing. It's not usually poor hygiene. It's partly caused by hormonal changes.
Hormones again.
Yep. Increased progesterone makes your gums more sensitive to the bacteria and plaque. They get inflamed more easily.
So what do you do?
The solution is practical. Be sure to brush your teeth twice daily and floss daily. Good dental hygiene is extra important during pregnancy. Untreated gum disease has even been linked, rarely, to preterm labor. So it's worth paying attention to.
Good to know. And then there's a specific kind of pain people mention.
Yes. Round ligament pain. Very common, very distinctive. On either side of your uterus, you have these two ligaments like cords.
Okay.
In pregnancy, they stretch and thicken to accommodate your growing belly and support that expanding uterus. This stretching can cause a specific pain.
What does it feel like?
Often a short, sharp stabbing pain, maybe in your lower abdomen or groin, especially when you move suddenly, like coughing, sneezing, laughing, standing up too fast.
Ouch.
Or it might be a dull ache after an especially active day. Your body is literally making room.
Makes sense. Any relief tips?
Yeah, the source suggests, if it hits, try to stop and rest. Pay attention to your posture. Change positions slowly. Gently massage the area or take a warm bath. Some also find a maternity belt for extra support, helps take pressure off.
Practical advice. But if it's severe,
Always call your provider if the pain is severe or comes with fever, chills, bleeding, or unusual discharge. Don't hesitate.
okay, good distinction. So the body is making space, adapting quickly, and all this growth needs fuel. Which brings us to appetite.
Yes. For many, here's where it gets interesting again. Increased appetite.
Finally hungry again, maybe?
Maybe. The source says pregnancy hunger starts and peaks in the second trimester. After potentially weeks of nausea, this can feel amazing. Your body is working incredibly hard supporting the baby, and that requires plenty of energy.
Makes sense.
But it's not just for the baby. Your meals are also fueling your body's changes. That bigger blood volume, growing breasts and uterus, those necessary fat stores for later energy.
Right. The whole system needs more fuel.
Exactly. And the source even quantifies it. You need an extra 300 to 350 calories per day in the second trimester.
Which isn't actually a huge amount, is it?
No, it's roughly a small, healthy snack, like an apple and some nuts or yogurt and berries. It's not eating for 2 entire meals.
Quality over quantity.
Precisely. The key is making sure those extra calories come from nutrient-dense foods. The source strongly encourages learning about planning healthy pregnancy meals to get the right balance of protein, complex carbs, healthy fats, vitamins, minerals, listening to your hunger cues, but making smart choices.
Absolutely. Fueling yourself well is key. Which leads us perfectly into our next section, the 14-week checklist, practical steps for a healthy pregnancy.
Right. This raises the question, now that you might have more energy and fewer early discomforts, what practical things should you actively be doing?
Okay, what's first on the list?
Prioritizing dental health. Often overlooked. The source strongly advises it's safe to go to the dentist during pregnancy, and actually it's highly recommended.
Because of the gum issues we mentioned.
Exactly. That's susceptibility to gum inflammation, potential periodontal disease, even increased risk of cavities, maybe from dietary changes or sickness. It's crucial to tell your dentist and hygienist you're expecting,
Why is telling them so important?
so they can take precautions, like using lead aprons for x-rays if absolutely necessary, or adjusting any medications. Regular checkups and cleanings aren't just safe, they're protective.
That's a great reminder. Dental health might slip down the priority list otherwise. What about staying active?
Big one. If that energy is returning, the source highly recommends finding ways to get active, maybe a prenatal exercise class. The benefits are huge.
Like what?
Well, exercise can boost your mood endorphins, help you sleep better, lower risks of complications like gestational diabetes or preeclampsia, reduce stress, ease physical discomfort,
Wow, lots of benefits.
and even help prepare your body for childbirth by building stamina and strength. Of course, always check with your provider before starting something new.
Good caveat. What if you need motivation?
The source suggests joining a class like prenatal yoga or water exercise. These are tailored for pregnancy, safe, structured, and a great way to meet other expecting moms. Build that support network.
Oh, that's a great bonus. Combining physical and social well-being.
Exactly. It's holistic.
Fantastic advice. Okay, let's unpack some more personal planning type items on the checklist. Things that start making the baby feel very real. First up, brainstorm baby names.
The fun part. Or maybe the stressful part for some couples.
Huh, true. Whether you have a secret list or haven't thought past baby, it's definitely not too early to start pondering names. Such a personal, exciting step.
Laying groundwork for their identity.
Yeah. The source points to resources like their baby names finder. You can look up meanings, history, popularity, explore inspiration lists, see top names from way back.
Like 1880.
Right. Can spark ideas or help you avoid names that are maybe too popular right now. It's a fun process, hopefully.
Hopefully, a delightful part of the journey. And then there's that nearly universal pregnancy challenge.
Huh.
Sleep. Or lack thereof.
Oh, yes. Get better sleep.
Yeah,
Easier said than done sometimes.
totally. The source acknowledges there are plenty of reasons why it's hard to sleep well when you're pregnant. Hormones, discomfort, anxiety, the list goes on.
But are there remedies?
Thankfully, yes, plenty of remedies to try. Practical things. Cut down on caffeine, especially later in the day. Try relaxation techniques like deep breathing or meditation. Experiment with the right pregnancy pillow.
Those pills can be lifesavers.
Definitely. Finding a comfortable position gets harder. Establishing a consistent bedtime routine helps signal your body it's time to wind down. Even warm milk and a light snack can help.
Okay, those sound helpful. Any cautions?
Yes, a crucial one. The source warns that while things like herbal and hormonal sleep remedies like melatonin might seem harmless or natural, they aren't necessarily safe during pregnancy. Even over-the-counter stuff, you absolutely must consult your healthcare provider before taking any medications or supplements, even natural ones. Many can affect the baby.
That is critical advice. Natural doesn't automatically mean safe in pregnancy.
Not at all. Your provider knows your situation. Another practical self-care item, more for comfort. Invest in a good moisturizer.
For stretch marks.
Well, the source is clear. Lotion may not prevent stretch marks. Those are mostly genetic, about deeper skin layer stretching. But a good moisturizer will reduce itchiness.
Ah, itchy skin is common, right?
Very common. Hormones plus skin stretching can make it dry and itchy. Keeping it hydrated just makes you feel more comfortable as everything expands.
Makes sense. And finally, on the practical side, a really important discussion about work, workplace support, and rights.
Yes, connecting this to the bigger picture, navigating working while pregnant, which, let's be honest, isn't always easy. The source highlights scenarios needing modifications. If your job is strenuous, heavy lifting, long-standing, if you're around harmful chemicals, or if you have certain pregnancy complications requiring rest.
So you have rights in those situations.
Absolutely. The source reminds us, there are laws in place that protect you from discrimination because of pregnancy, and you may be able to receive disability benefits. Laws like the Pregnancy Discrimination Act, maybe FMLA, it's vital info.
So what's the process?
The advice is, talk with your doctor or midwife first. Get their clear medical take on limitations or needed adjustments. Then, with that professional guidance, approach your supervisor or HR about making adjustments, especially for demanding roles. Protect your health and know your rights.
Incredibly important info for navigating work. Okay, let's move to our final section, the bump journey variability and perceptions. So what does this all mean for how your belly actually looks?
Yeah, this is a big one for many people.
The source emphasizes a core message, really reassuring. There's no right or wrong when it comes to pregnant bellies and how they appear.
So important to hear that.
It directly tackles that common anxiety. Some women worry that their baby bump is too small. Others worry they look more pregnant than they really are. That comparing game.
Often fueled by social media or comments.
Right. It can cause real stress when it shouldn't. So many factors influence how and when you show. Body type, muscle tone, first pregnancy or not, even the baby's position.
It's incredibly variable.
Yeah.
Which raises the question, why do people feel they can just comment on a pregnant person's body? And how do you handle that?
Good question. What does the source say?
It points out the social dynamic.
That's right.
A lot of this can be driven by comments from friends, family members, and even strangers. Many people think a pregnant woman's body is an open topic of conversation.
Yes, the unsolicited commentary.
Exactly. You might hear things like, you don't even look pregnant. Or the opposite, wow, are you due soon? You're huge. Often unhelpful, sometimes hurtful.
Even if well-intentioned sometimes. Sometimes. Often just thoughtless. The key advice from the source is clear and empowering. Try not to take it to heart. Your journey is yours alone.
Easier said than done sometimes, but good advice.
And it concludes with the ultimate reassurance, the only opinion that truly matters here. As long as your healthcare provider says your baby is developing well and you're having a healthy pregnancy, it's all good.
Focus on the medical facts, not the sidewalk commentary.
Precisely. Trust your provider's assessment. That's the real measure.
And that really brings us towards the end of our deep dive into the 14th week of pregnancy. Wow, we covered a lot.
It's a busy week.
It really is. From that exciting, often hoped-for shift into the second trimester, the amazing fetal developments like tiny facial expressions, first hair follicles, to the common symptoms parents experience, like maybe less morning sickness, but new things like round ligament pain. And that crucial practical checklist, too. Dental care, exercise, thinking about names, sleep strategies, knowing your workplace rights. It's a comprehensive shortcut to understanding this key stage. Definitely offers insights beyond just the surface-level facts.
So wrapping up, what's the bigger picture takeaway here?
Well, if we connect this to the bigger picture, what this deep dive into week 14 really highlights is the incredible, rapid, often invisible development happening inside. It's a profound testament, I think, to the subtle, but immense power of biological processes, adaptation.
Not just in pregnancy, but generally.
Exactly. It's fundamental to life, just beautifully illuminated here. Consider how the body, without any conscious instruction, starts making faces, growing hair, developing organs for future use, while simultaneously adapting and expanding to host this new life, all in sync.
It is pretty mind-blowing when you think about it like that.
So maybe a final thought for you, our listener. How does this week's journey, this intricate dance between internal development and external experience, illuminate those ongoing processes of growth, change, and the remarkable resilience inherent in life itself? What might it teach us beyond just the context of pregnancy?
Something to definitely ponder.
We encourage you to reflect on your own journey, or just what you've learned today, and let that curiosity keep guiding you as you explore the wonders of human development.